Hello, this is Spellbinder with this story about how, well, big farmers won the game in Europe. It looks like they're going to take natural herbal medicines and make anyone that wants to sell them produce a product out of them. They have to go through the same stringent conditions that regular drugs have to go through. Costs several hundreds of thousands of dollars to test a drug over a several year period before it becomes legally able to be sold on the market. There we go. Big Pharma scores big win. Medical herbs will disappear in the EU. In the European Union. Apparently Kodiak's armamentaris must be working well there. It's almost a done deal. We are about to see herbal preparations disappear, and the ability of herbalists to prescribe them will also be lost. By Heidi Stevenson, 12th of September 2010. Big Pharma has almost reached the final line of its decade-long battle to wipe out all competition. As of the 1st of April 2011, less than 8 months from now, virtually all medical herbs will become illegal in the European Union, and the approach in the United States is a bit different, but it's having the same devastating effect. Oh man. The people have become nothing more than sinks for whatever swell big pharma and agribusinesses choose to send our way. And we have no option but to pay whatever rates they want. $50 for a tablet of vitamin C. Get ready for that. 40 pounds. It's going to be pretty upset. It's going to be upsetting as all hell to me. Because I know this stuff works, and what they're putting out is poisons. And that's what they do. It's just part of Agenda 21. Just another page. Big Pharma and agribusinesses have almost completed their march to take over every aspect of health, from the food we eat to the way we care for ourselves when we're ill. So we have no doubt about it. This takeover will steal what health remains to us. If you want to skip the text and find out what you can do, you can click here. It begins next April Fool's Day. In the nastiest April Fool's joke of all time, the European Directive on Traditional Herbal Medicine Products, the THMPD, will enact back on the 31st of 2004. It laid down rules and regulations for the use of herbal products that had previously been freely traded. This directive requires that all herbal preparations must be put through the same kind of procedure as pharmaceuticals. It makes no difference whether a herb has been in common use for thousands of years. The costs for this are far higher than most manufacturers other than Big Pharma. See, Big Pharma is the only one that's got money. Big Agro is the only one that's got money to pay the fines, like S510. I mean, this is the same crap. Can bear with estimates ranging from 80,000 to 120,000 pounds per herb, and with each herb of a compound having to be treated separately. So each one, vitamin C, vitamin D, it's not going to be like multivitamins and have it all under one umbrella. Oh no, it's going to take each one of those vitamins, each one of those natural cures made from herbs, and charge what they would do to come up with like a new penicillin or a new aspirin form, or any type of, like, for nasal drain, anything. I mean, it's going to be like Nasorex, it's a single product by itself. It had to go through all this money to make it possible. I mean, this type of stuff coming down the pipe. Here it comes. It matters not that a herb has been used safely and effectively for thousands of years. Oh no, it doesn't matter if it has a background of being safe. It will be treated as if it were a drug, just brand new, synthetically designed, and needs to be tested. Of course, herbs are far from that. They are preparations made from biological sources. They aren't necessarily purified, as that can change their nature and efficiency, just as it can in food. It's a distortion of their nature and the nature of herbalism to treat them like drugs. That, of course, makes no difference in the big Pharma-ruled Ephesus in the EU, which has enshrined the corporatism in its constitution. Dr. Robert Verkerk of the Alliance for Natural Health International, ANH, describes the problem of requiring drug-like compliances on herbal preparations. Getting classical herbal medicine from a non-European traditional medicine culture through the EU registration scheme is akin to putting a square peg in a round hole. The regulatory regime ignores and thus has not been adapted to the specific traditions. Such adaptations are required urgently if the directive is not to discriminate against non-European cultures and consequently violate the human rights. Trade laws. To best understand how this can happen, one needs to see that trade laws have been at the center of the moves to place all aspects of food and medicine under the control of the umbrella corporation Big Pharma and agribusiness. Man, this is so much like Resident Evil's umbrella corporation. Everything under a single thing. One corporation of all. If you've followed what's been happening in the United States regarding raw milk and the Food and Drug Administration's FDA's claim that foods magically become drugs when health claims are made, you may have noticed that the Federal Trade Commission has been part of the process. Rather than treating food and traditional medicines as human rights issue, they have been treated as trade issues. Yes, they see everything's under a trade codes. That makes the desires of large corporations the focus of food and herbal law rather than the needs and desires of people. It's this twisting that has resulted in the FDA's making outrageously absurd statements such as claiming that Cheerios and walnuts quite literally became drugs simply because of health claims made for them. Yes, Cheerios, you'll have to have a prescription to have your bowl of Cheerios with milk that's been processed beyond its means, instead of having it with good old raw milk that has more vitamins and stuff that hasn't been destroyed by the heating process. How to fight this encroachment on our health and welfare? It's not a done deal, at least not quite. If you value your access to herbs, or if you care about the access to vitamins and other supplements, please take action. Even if these issues seem meaningless to you, consider the people who do care. Should they be denied the medical treatment and health maintenance of their choice? The ANH has been active in fighting these encroachments. They are currently going to court in an attempt to stop the implementation of the THMPD. We can hope that they'll succeed, but recent history shows that no legal maneuvers is likely to stop this juggernaut. We cannot afford to sit back and wait for the results of their efforts. We need to see their endeavors as part of a whole, one in which each of us plays a role. It's up to us, each and every one of us, to take action. If you live in Europe, please send a letter or message to your member of European Parliament. Go to this page, and they have a page here for you, to find out who is your MEP and contact information. Then send a letter to that states, in no uncertain terms, that you strongly support the ANH's actions in trying to suspend the implementation of the THMPD, and that your hope that they will also take a stand in support of the people's right to choose herbal treatments. If you find it difficult to write such a letter, click here. For a sample in the universal RTF format, suggest that the ANH feel free to use it. Or it's suggested by them, then you're free to use it. Dennis DeLay has kindly translated the letter into Spanish. Thanks. Try to imagine facing your children or grandchildren when they ask you why you didn't, and how will you tell them that you really weren't that interested in their welfare? How will you tell them that it was more important to watch the latest fake reality show on TV than to take the time to write a simple letter? It is only by actively protesting that this travesty against our welfare can be stopped. If we sit back in apathy, and then it will happen. Our rights to protect our health and that of our children is hanging in the balance. If you care for your child's or grandchild's welfare, then you must act. Speak out. For now is the moment of truth. You can sit back and do nothing, or you can speak out. And then once you have, talk to everyone you know. Then tell them that it's time to act. There truly is no time to waste. This is really vital. This is something that they're coming up with. Again, this is probably part of the Kodiak's armamentarius, that somehow they're using something, it's not quite it, but very close to it. I mean, in America, Obama just pencil whipped it into an executive order and said, oh yeah, Kodiak's armamentarius, huh, there it is, now we got it. Yeah, that's Obama for you, Marxist socialist of our country. He's going to be indicted. That's what we want to do. We want to indict this man, because if we indict him, everything he's passed, everyone he assigned into office, all the czars, some type of, communist thing, will all go away. They will be noid and void, or null and void. Well, until next time, this is Spellbinder telling you about this issue. It's pretty, I feel sorry for you people in Europe if this is going through, because you have the right to choose your own treatment and your own medicines and everything. These people are just greedy, money-making control freaks. And that's what they are, and they're trying to do the same here. It's called control freaks have taken over. And these people have mental disorders. They are. That's a sickness. Is wanting to control somebody. And it's called a psychopath. They love to control somebody. I mean, that's what they are. That's an illness. Until next time, be good at it, and have a good day.